Hello, this is Shan Bowers, and I did my case study on autism spectrum disorder, and I read the book Thinking in Pictures by Temple Grandin. Autism spectrum disorder is a neurodevelopmental disorder that affects cognitive functions, social skills, communication, and behavior. The current Diagnostic and Statistical Manual of Mental Disorders now list autism spectrum disorder instead of the previously 4 listings of autism, Asperger's syndrome, pervasive developmental disorder, and childhood disintegrative disorder. There's not a specific cause or known cause for autism. Many individuals think that it is both genetic and environmental factors, usually in combination. There's still a lot of information that needs to be done. The CDC actually notes that 1 in 50 children will have autism, and it is actually 4 times more likely in males. Many think that the increased rate of autism is due to more awareness and better diagnosis of autism. The DSM list as the diagnosis, symptoms of diagnosis is repetitive patterns of behavior and poor social communication. There isn't a medical or biological test for autism. There's with the increased awareness, there's more screening done, and if a child, after being screened, is thought of having autism, they will be they will go on to a further screening with doctors and psychiatrists, and more tests will be done to conclude the diagnosis. There's the symptoms of children under 2 with autism include limited social response, difficulty communicating, sensitivity to environment, and general inactivity. The symptoms for children over 2 would include also difficulty communicating, high levels of distress over minor changes, just anything as small as moving an object to somewhere else in the room, significant time with seeking sensory input, whether they're twirling or hitting their head off the wall or any other type of sensory input, repetitive motions. Some are noted as having a decreased sensitivity to pain also. And in her book, Temple displays many of these symptoms. When she's younger, she has a lot of repetitive play. She what else did she do? She also notes that she would like to wrap herself in blankets or get in small crevices or in, in similar activities like that, which is also very common. Uh, she actually when she went to visit her aunt's ranch, um, she noticed that the phone keeps ringing. I'm sorry, I have to turn off the phone real quick. Okay, where was that? Well, yeah, when she visited her aunt's ranch, she noticed that the cattle would go into a cattle chute to hold them when they needed vaccines or uh, any kind of veterinary care. Uh, but she noticed a slight relaxation whenever they were in the chute and they were constricted a small amount. She actually got into the chute and asked her aunt to close it on her, and she stayed in there for 30 minutes and noted that her anxiety had decreased, and it helped her, and she continued to use this machine for she still uses it. She's made many modifications and improvements over time, and was actually the first she was the first person to use this type of machine. When she returned home, she took the machine to school, and most of her teachers and other individuals at the school thought that it was weird, and they wanted to take it away from her. But she did keep the machine, and there's also been many other instances of people doing similar things. There's a man in another book that I was reading. His name was Tom McKenna or something similar. But anyway, he has more sensory problems than Temple, and he actually will place two wristwatches on each arm and tighten them to very tight, almost to where it cuts off circulation, and he says it causes a great improvement. There's other people have made weighted vests, and these were all older cases. Now there's so much available for sensory help. There's hundreds of, possibly thousands of different items. We just recently got a weighted blanket for my son, and we've noticed some improvements. We haven't had enough time to to use it yet, but I mean for a long period of time. But there's everything. There's lights. There's all kinds. The improvements. There's way more options now. I mean, the awareness has increased so much that it has helped. Because in the past there was no awareness. There was hardly any information or research being done on autism and autism spectrum disorder. But children with autism sometimes are thought of as being deaf, and when they are not, because of I mean, an example would be my son. I may be in the other room opening up a can of pop, and he'll come in there, wanting to drink a pop, but I could be in the same room as him and say his name repeatedly, and he won't acknowledge or answer. But I mean, I knew he wasn't deaf, and there have been a lot of similar instances where they thought of as being deaf or having hearing problems of some type, but that is usually not the case. Uh, uh, Temple Grandin also notes that she was fine on her hearing test, but there was a hearing test developed specifically for individuals with ASD, and she had very low scores on that test, and the test mainly focused on two conversations at once and distinguishing what was being said in one conversation. She also notes that the background noise, she does have problems whenever there is background noise. The treatments for autism, there is no cure for autism. There's just certain techniques to help with the symptoms. The most common would be behavioral therapy. Most children are enrolled early in a speech or occupational therapy, and that is the most important time. When the brain is learning at a young age, and many individuals with autism have noted having success with antidepressant drugs. Temple Grandin takes antidepressant drug daily. Many doctors agree, though, that people with on the autism spectrum disorder require much lower dosages, half or a third of a normal dose for a depressed, non-autistic individual. There's also a different medication. I mean, certain symptoms are more prevalent in autism. Every case is so unique that it's no one answer. Certain drugs will work better than others. Certain treatments will work better than others. That's why it's important to keep progress of the individual and see what symptoms are declining, because there's so many options. There isn't one direct answer, because it's a very, very, very unique disorder, and that's why the prognosis is also varies. It would depend if you were a high functioning individual with autism spectrum disorder. Temple Grandin would be considered high functioning. They tend to lead pretty normal lives. They may have some small social awkwardness, but most of them have normal jobs, usually ones that don't have as much social interaction. And then there's low functioning individuals with autism spectrum disorder, and they have very poor communication. Most will never be able to speak, and unfortunately will probably have to have a caregiver for the rest of their life. Ellen, in conclusion, the most important thing is early diagnosis. Uh, with early diagnosis, a child can be enrolled into therapy and will ultimately reduce their symptoms and they will be able to live a better life, uh, which which is why Temple Grandin has had such success. Her mother was always making sure that she had the best resources available, and it was at such a young age. And luckily, this has with the awareness in recent years, uh, there has been more research. There's been more information on autism spectrum disorder, and luckily this has led to early intervention and individuals to have a better chance of a normal life. But there's still a long way to go. There's so many questions that are not answered concerning this disorder, and we need to keep moving forward and learn as much as we can. And early screenings, it's a very common disorder, so it's there. I want to thank you for this class. I did enjoy it. It was very interesting. The subjects were very interesting. It was probably my favorite psychology class that I've taken so far. Thank you.